Now that we've gone over and discussed the prep, let's talk about how to fill the tooth. I also want to look again at the main aspects or the different things that we're trying to improve as we get better at dental fillings. There's improving your speed and efficiency, improving your quality, decrease complications, improve profitability, and improve the patient experience. After we've achieved our baseline level of competency, these are the things that we are trying to improve. Anything that we can improve in either of these categories is progress. The actual filling process is the slowest part and your greatest opportunity for improvement. Step one is isolation. You need good isolation. For most fillings, I am just using cotton roll and dry angle isolation. If you start prepping and realize the person is salivating out of control and their tongue is out of control, you may want to switch to something like an isolite or something more aggressive. Many times your ability to fill multiple teeth at once depends on having great isolation and patient cooperation. If your patient is not super compliant and isolation is difficult, take that into advisement when planning how many teeth you're going to fill at once and where those teeth are. Cotton roll and dry angle isolation may sound simple, but I see dentists do this wrong all the time. You need to pay attention to the amount of space they have between their tongue and their teeth. Sometimes patients have a tremendous amount of space, and you need 2 or 3 cotton rolls to fill that space adequately and provide adequate isolation. If you only put in 1 cotton roll there, or you don't place the cotton roll at the base of the tongue, it does not work well at all. If you place the cotton rolls where you should be, you will get great isolation. Also, a quick tip is most people should just try to shove the cotton roll in there, but I find that if you roll the cotton roll into place, it works so much better. Sometimes there is just so much friction or the cotton roll sticks to the tissue and you can't press it where it needs to go. But if you roll the cotton roll into place while putting it by the tongue, it will go down where it needs to go. I always place cotton rolls before I prep. And in a percentage of patients, I don't have to place more for the filling process. However, if they are difficult or there's a lot of saliva, I will always place new cotton rolls right before I fill the tooth to make sure I get great isolation. Now, the second step is placing the matrix system. Now, I'm using the V-ring or Paladent systems most of the time. These systems are great because they're super straightforward, very easy to use, and we are looking for something that's fast, efficient, that creates good contacts and allows us to fill the tooth without any voids or issues. The first thing is to make sure you are using the right matrix band. There are typically 3 that I use. 1 for the premolars, 1 for the molars, and 1 for the very deep molar caries. When placing these, you need to make sure that you get the contact position in the correct spot for each tooth. If your matrix is too deep or not deep enough, then that contact position is not exactly where it should be, then it doesn't matter how good your system is, you're just not going to have a good proximal contact. So pay attention that you have the right positioning for that band. It should be very easy to place these as long as your prep is not too small or too conservative. It is extremely frustrating to try and place the matrix and find that you don't have enough separation or haven't broken the contact adequately, and you have to go back and prep more. I'm surprised at how many dentists fill adjacent fillings separately, like 13 MO and 12 DO. Most of your efficiency with dental fillings comes from being able to fill more teeth at once. The more you can do, the better. Each round of etch, bond, packing, curing adds a tremendous amount of time to your appointment. You should strive to do everything in 1 round. This may not always be possible, but that should be your objective. At the very least, you want to do all of the teeth around each other in 1 round. If you only fill a 12 DO and then you go back and try to do a 13 MO, not only is that slow because you've done it more than 1 round, but it's worse because of the time that you're filling adjacent fillings in multiple rounds. You're actually just causing additional bleeding and the problems go up and just make it harder and harder than it should be, especially if you try to remove or replace additional matrices every time. Depending on the patient's gingival health, they're going to be bleeding a ton, and now every other filling you do becomes exponentially more difficult. If you have to do it in 2 rounds, always start with the hardest area of isolation first, and then go to the easiest in the second round. I'm not sure it's necessary to go into wedging and all that because, that part is pretty obvious. I make sure my matrix is in the right position, and then I hold it down with my finger as I place the wedge, so the positioning or the vertical alignment does not change. The wedging should be tight enough to make the matrix band stable so that when you put your ring on the tooth, it doesn't move positions. Now let's talk about optimizing your matrix system. The V-ring system is great because you can absolutely do multiple teeth in a row, and it works pretty well. Most dentists I see have a ring that only has, or have a kit that only has 2 rings in it. I think you should have 4, at least. too narrow and too universal. If you have two, that limits your efficiency quite a bit. One of the biggest problems with the rings is making sure that they stay properly tensioned. Over time, if your contacts aren't as good, this is often the culprit. Every time you stretch that ring out, you're slightly weakening its tension. You should check that at least weekly to make sure that those rings are tight and tensioned. All of your separating power comes from the tension of that ring. If you struggle with getting tight contacts, I would absolutely start by making sure the rings are properly tensioned. Also, I will often use the universal ring for molars and the narrow ring for premolars. However, I find that the narrow ring has a little bit more tension and better separating power, so I will use the narrow ring anytime I have back-to-back MOD fillings where I am filling two adjacent interproximal areas in one go. Now, properly tensioned narrow rings give me great separating power for those situations. You also need to make sure that the contacts are in the proper position. If your matrix is placed appropriately with the right ring, you will get good interproximal contacts. The V-ring system is kind of nice because the forceps have a little pin that enable you to easily grab and place things quickly. I will usually have the assistant hold these in their hand and then put them close to the mouth so I don't have to reach far to get everything in place. I will then go tooth by tooth, placing the matrix and the wedge until I am satisfied with each location. Then I will place the rings to get everything stable, and then I will use a small ball burnisher to shape and position and burnish things until I am confident about the positioning. I will then replace the cotton rolls or add a cotton roll or dry angle if needed. For the dry angle, for it really to be helpful, I make sure it is placed in the far back corner of the mouth, as far back as possible. I often see dentists not placing it far enough back, and it's not that helpful if that's what you end up doing. It must be placed in the very far back corner to be effective, almost right against the bone in the corner of the ramus. Once this is done, you are ready to get filling. Now, again, I'm not going to tell you the exact materials that you should use, but I do think there are opportunities to improve on what I do with newer materials. I use the materials I do because I've used them for quite a while and they are very predictable, with little to no complications or issues. They are also fairly inexpensive. I use an off-brand type of the Optibond Solo Plus for my bond. I etch the entire prep, not just the enamel. So I go in and etch everything, let that sit, rinse it all off. I then scrub a liberal amount of bond into all the areas for at least 5 seconds or more, and then I air thin, making sure that I don't have any big pools. If you let bond pool up where the matrix meets the tooth, that's where you get those ugly x-rays that look like they might have a gap. So I always make sure to air thin that area as well. Once that is done, I cure everything for at least 3 seconds with a typical high-power curing light. I use SonicFill to fill everything, and any bulk fill will probably work pretty well. I used to use flowable and then packable composite. When I didn't use flowable and just used packable, I found it an increased likelihood of voids. Then I switched to flowable with packable and it helped, but I still ended up with more bubbles and issues compared to using SonicFill. SonicFill has a handpiece, and when it vibrates, it turns it into the consistency of flowable. When the vibration stops, it becomes the consistency of packable. So I go through and place SonicFill in all my posterior areas and then use a burnisher to quickly ensure that it's full and remove a little bit of the excess. Then I cure everything, and SonicFill flows so well that you don't really ever have to pack or condense much because it just fills all the voids in one go. Once I switched to this, I haven't really had any void issues, and I noticed a big decrease in post-op sensitivity compared to flowable and packable composites. Now, when you are doing lots of fillings at once, one of the areas that is easy to mess up is incomplete curing. Sometimes I think we put too much faith in bulk fill, and I've seen times where it's not curing to the extent that we would like. So what I do is once I remove all the matrix and bands and the wedges, I have the assistant cure everything from the buccal and lingual again while I'm switching out my burrs and getting ready for finishing. It's a little redundant, but it makes me feel better, and because I'm doing it while changing out my burrs, it's not really wasted time. For finishing, I start off by having my assistant do a power rinse with air and water to get everything clean. If you're doing a lot of fillings at once, this is super helpful to see everything clearly. It's good to instruct your assistants when to do a power rinse versus a normal rinse. For finishing burrs, I only really use 2 burrs, a round diamond and a thin flame carbide. I start off with the round diamond, going over all the teeth just to clean up the occlusal surfaces completely. In a prior video, we talked about visualizing the tooth before and after the prep. This is another thing that I want you to keep top of mind and practice. Try to remember what the tooth looked like before you touched it, and keep that image in your mind as you finish. When you get good at this, it reduces your finishing time dramatically and makes it simple to get the occlusion where it should be. After cleaning up the occlusal surfaces with a round diamond, I take the flame carbide and go interproximally and clean up any excess. If needed, then I'll open up the occlusal embrasure a little bit as well. And then at this point, I take an enhanced polishing cup or point and polish everything down at remaining excess. And then I do a quick floss when needed, check the bite, and make sure everything looks good. That's about it as far as the process. This is a good baseline workflow for your dental fillings. Once you're doing this consistently, you'll have a solid foundation to build on. So start finding ways to fill more teeth at once, simplify your filling process, and speed things up while reducing your complications. Anytime you do a filling and find something that didn't work well, it was slow or was frustrating, write it down and try to improve it. Don't let frustrating things happen without taking note and making it easier the next time. If you don't, it'll happen again and again, and you'll stay frustrated for the rest of your career. Fix issues when they arise. Now, remember the key areas that we discussed: improving speed and efficiency, improving quality, decreasing complications, improving profitability, and improving the patient experience. Any improvement in these areas is progress. The moment you stop trying to progress and improve is the moment you'll burn out, get bored, and start hating clinical dentistry. Maybe there's nothing too crazy or new here technique-wise, but I hope this helps you shift your mindset and improve how you work. Establish a strong baseline and a great technique, then strive for continual improvement. If you go through a day of dental fillings and don't write down any weaknesses, frustrations, or areas to improve, that's a failure. Keep improving and progressing, and you'll ensure that dentistry stays fun, rewarding, and fulfilling. Thanks for watching, and let's keep working together to make dentistry fun, rewarding, and fulfilling. Don't forget to subscribe and stay tuned for more.